Meanwhile, New South Wales and Queensland have recorded a number of new infections, pushing the nationwide total well above 100 cases. In New South Wales, the new patients are 4 women and 2 men, ranging in age from their 30s to their 60s. 4 of the cases have recently travelled back from the United States, Switzerland and Italy. One other is linked to a Sydney aged care resident who died, and the final case is still being investigated. In Queensland, 2 of the new patients have recently returned from Europe, while the last case is the partner of another patient. All 3 are in isolation in separate hospitals. The federal government is reviewing its travel advice for Italy as the country is forced into effective lockdown. Medical experts are also moving to ease pressure on our health system, inundated by patients presenting with general cold and flu symptoms.
Panicked patients fearing the worst are putting unnecessary pressure on hospitals. Chief Medical Officer Brendan Murphy says the only people who should be getting tested for COVID-19 are those who have recently returned from overseas or have come into contact with a confirmed case.
There have been people requesting COVID-19 tests who don't currently warrant the testing. Our focus at the moment is testing people who are return travellers who have acute respiratory symptoms, cough, sore throat and the like, and contacts of confirmed cases.
After several healthcare workers were diagnosed with the disease, there are calls for mandatory testing.
The Australian Health Protection Principal Committee will be making a recommendation about whether healthcare workers should also be tested in some circumstances, but that recommendation is still to come.
About 100 people have now been diagnosed with COVID-19 in Australia, the majority of those cases in New South Wales. The government is now considering new measures to help cap the spread of the disease on home soil, including a ban on foreigners entering from Italy.
The medical experts to review the status of Italian travel advisories. We have done that obviously on the basis of the growth in cases over the last 48 hours in particular, and with regards to Italy's own decisions. That advice will be forthcoming over the course of the next 24 hours.
As Australians worried about developing coronavirus have swamped the nation's dedicated hotline, Labor is calling on the government to make it easier for people to access information about the disease.
One thing the government, I would suggest, should take up is our suggestion for an app, a go-to one-stop shop, virtual one-stop shop that anybody can log on to their telephone, get the latest advice from the Chief Medical Officer, the latest advice as to what they should do if they fear they might have COVID-19, advice as to how to handle self-isolation and quarantine, etc.
It's been revealed some planned cardiac surgeries at Westmead Hospital in Sydney have been moved to its private facility nearby in response to expected increase in patient demand from COVID-19. Yesterday, 2 patients received surgery at Westmead Private Hospital. A further 8 will undergo procedures at the facility in coming days.
It should have been done weeks ago. This is the problem, is that people are a little bit like maybe it's going to be different here to Italy. At some stage it's not going to be any different because the virus will behave very similarly.
Charlotte Mortlock, Sky News.